Always paid my bills on time. My credit cards, now they're all due, and I don't know what to do because I have no funds.
New at 6 o'clock, they've closed the doors, leaving healthcare workers without pay and their patients without care. Employees of Silver State Health Services are now speaking out while waiting for 3 weeks of back pay.
8 News Now reporter Laura Negretti investigates whether this sudden closing could also include the misuse of public funds. Lauren.
Brian, Denise, out-of-work employees say that federal funds were misused, but have yet to prove it. Now, the chairman of the Silver State Health Board says it's all just rumors, but he does confirm the loss of federal and state funding that led to a shutdown.
The doors are locked at Silver State Health Services, leaving uninsured and underinsured patients scrambling and its employees looking to be paid.
That final check for me was what I needed to pay bills.
Samantha Payne and others receiving a layoff notice effective February 9th. 5-year family nurse practitioner Romelia Watson says the problem started before.
We were asked multiple times last year to hold our paycheck. Employees' paychecks bounced due to insufficient funds. Just most recently, our clinic was infested with rats.
I've never heard anything about any rat infestation.
However, employees sent me photos of a dead rat and droppings across desks. While I couldn't get a hold of the current CEO, chairman of the board, Ron Clark, confirming.
There were a couple of times when employees were asked to hold their checks because Medicare were late paying.
Not being able to cash our checks on time or not being able to get paid for the last 3 weeks, that we're just, facing eviction or utilities are being turned off. We're not being able to provide for our families.
Never dealt with situations like this, and it's just hard to deal with.
A February 14th letter from Silver State reading healthcare financing from Medicaid abruptly suspended reimbursements, caused problems with your pay, and continues, there is no monies of significance to complete the most recent payroll nor your last payroll. Clark says the FBI subpoenaed staff, but nothing came of it. But that was enough to prompt an audit from the Health Resources and Services Administration and loss of federal and state funds.
The Nevada Medicare shut down our revenue. They owe us all the money from early December through now without paying us because they said, oh, you're under investigation. Could be fraud. We don't know.
He says they can't pay employees without those funds. Employees trying to recover money, frustrated with the Department of Labor closing the case when they couldn't reach Silver State.
The employees have a GoFundMe for some financial relief and say they're pursuing the matter with state and federal authorities. Now, the OIG and FBI couldn't confirm or deny an investigation.
Lauren, thank you. Now, another concern employees raised double federal withholdings blamed on a clerical error. Clark had not heard of that issue.